All right. Welcome to the Creighton University CPHHE Mental Health Podcast. My name is Monica Lewis. I am a licensed independent mental health practitioner with Lewis Counseling and Visitation Services. And I have Johnny with me as well as Peyton. Johnny, introduce yourself for me.
Johnny No Good, founder of Beyond the Stigma, an intergenerational peer support group for Black men and mental wellness. We've been in business and running since 2022.
All right.
Yeah, and I'm Peyton Hogan. I'm the owner of Bear Company Counseling. I've been a licensed mental health therapist since 2019.
Congratulations, both of you in the community doing good work.
Yeah, hey, listen, I got a couple little mental health certifications. You know, the little mental health first aid. You know what I'm saying? Adult and youth. But hey, listen,
Don't make it small. Don't make it small. You doing big things. Don't make it small.
Listen. I'm with the Giants though.
That's
you know
right.
what I'm saying?
Listen, we all
so now they
Giants.
associate me with the Giants.
There
you
we
know
go.
what I'm saying?
Hey, there
I'm
we
with the
go.
Giants.
There we
we
go.
go.
There we
my
go.
lightweights on y'all. Nah.
And I think the most important part is the fact that we all love our community
That
and we
part.
love the work that we do.
That part.
And because of that love is what brought us together today
That
to
part.
be able to do this podcast. So nothing small, always big.
That part.
So today we are discussing bipolar disorder. And I think it's one of those topics that get thrown out all the time, especially for us women. What's wrong with you? You got bipolar? Yep. I do, and I do.
I think there's a lot of misconceptions around bipolar disorder, though. Like people believe that when they get angry out of nowhere, they associate that with bipolar disorder, when that is not the case at all. You just got some anger issues you need to deal with. And there's other diagnoses that we can talk about, like intermittent explosive disorder.
Absolutely.
You know, a whole bunch of others. But bipolar disorder might not be it. And I think there's a place where we as people need to understand the difference between the types of bipolar disorder, because there's type 1 and there's type 2.
Then there's other ones in between.
And there's other ones in between. But when we're looking at it, like if we got a plate right here, and I'm trying to separate my food out, the main ones that people are really going to be associating with are going to be your type 1 bipolar disorder and type 2. And there's a couple of differences between each of them. And I think we should talk about them a little bit.
I think we should.
Yeah.
I think we should. Well, first off, I think most people recognize that when they hear bipolar, the first person that come to their mind is Kanye West, or Britney Spears.
Yeah.
Why do you think that is?
I think it has something to do with the sensationalism of media and the role that media play, because we identify most behaviors with the extremes. So we don't know what it looks like in the middle. This is a conversation that I'm going to be more just listening to, taking notes, and allowing y'all to take charge in. But I think it has to do with how sensationalized a lot of mental illnesses are. When we hear of anxiety, we think of people who just all over the place, jittery, heart rates and stuff like that. But we don't think about the different levels. We hear words like depression. We just think of somebody who's super sad, but we don't think about the person who's functionally depressed.
Right.
So I believe that bipolar is another one of those because of pop culture, right? Using words like gaslighting, using words like narcissism, when these are diagnoses that have to be administered by a professional. I think bipolar falls in that same category.
I asked that question because a lot of times within social media or just people, period, they use bipolar so loosely, and that's why you wanted us to break down the two for good explanation. And it also is what increases the stigma of people not seeking help because they don't want to be looked at like a Kanye West or a Britney Spears. People are people and everybody struggle. And so even Kanye, he's amazing with the things that he does artistically. And so we don't want to make anything small of that. It doesn't mean that you're crazy and that, people should be afraid of you. In fact, I feel like it's a superpower in its own little way. So when we look at bipolar disorder, we can look at the symptoms that goes along with it. And some of those symptoms could be some depression, some anxiety, periods of grandiosity, periods of a person who they're up on, in the middle of the night, can't sleep and they're more social than usual. They want to telephone a friend in the middle of the night. They want to get up and go to the casino. They want to rip and run. They up cleaning the house. They just doing the most. Sometimes we can see an increase in substance abuse with those that have bipolar disorder because they have so many racing thoughts. The thoughts are constantly racing, and they're can have an increase in sexual desire more than the normal. People always ask me that question. Well, why do you ask me that? Why do you ask me about my sex drive? And I always tell them because it's beyond just the normal level of horniness that a person naturally has when they're sexually active. A person who has bipolar disorder actually has like a heightened sexual kind of period, almost like their body is on fire almost is how it's described. And so then you have periods where a person can see shadows, like like something might be out the corner of their eye or moving around. And there's periods where they almost can feel paranoid, like people are out to get them, like something is wrong, but they're not quite for sure what something is wrong. They might check in windows and go into doors. And so people with bipolar disorder who might be looking at this might say, but Monica, I don't have all of those things. I have some of those, but I don't have all of those. And that might be very well true. But the periods of sadness and the anxiety and the depression and that the balance of those, and then periods of explosiveness, periods where they can become angry, like you talked about, those things kind of blend together. But when we're talking about the two different ones, and I'm going to shoot it back to you, Peyton, but when we talk about the two, you'll see that one has more focus on more of the depression points of it than they do more of the mixed episodes of it. And so that's the difference between the two. But I'll let you give a formal definition since you the definition and statistics guy.
Yeah, most definitely. So everything that you were saying from just like symptomology and experiencing like what people experience when they're going through bipolar disorder, right on. When we look at it from like a clinical perspective, right, we got bipolar 1, bipolar 2. Both pretty similar, but there's going to be some clear distinctions between both of them. Bipolar 1, we're looking at an individual who's experiencing definite depressive episodes with a period of at least 1 week of a manic episode. At least 1 week. It doesn't mean it lasts just 1 week, but at least 1 week of manic or of mania. And what mania is going to be that increased energy, that sense of grandiosity where I have like this super self-importance where the world is all of a sudden revolving around me. Now I have like all of these different ideas and I'm starting to put them to action. I got this renewed sense of self. I'm going over here. I'm buying all these different things. I'm having increased sexual desires. I feel like I'm on top of the world. And after that comes the crash.
I call it Pinky and the Brain. That's an old cartoon, Pinky and the Brain. I can take over the world.
Yup. It's just like that. It's just like that. You hit that deep. Now, where bipolar 2 is going to be different is there doesn't necessarily have to be a manic episode, right? They experience more of what is called hypomania, which are these shorter periods of mania. It's not as long and it may not be as extreme, but in some cases, right, when we're looking at somebody like I don't think I have anybody in particular, but somebody who has like these anger outbursts, right? That could be classified as a hypomanic episode, right? And that's going to be the clear distinction, right? There's this baseline hypomanic, baseline hypomanic, baseline hypomanic. It's not like baseline mania down into the depression, back up. Those are going to be the two distinctions, if that makes sense.
Right. Right.
Yeah, I think it's helpful for me just listening in on this conversation. I know my mother struggled with bipolar depression and bipolar disease as well. So she has been clinically diagnosed. So it helps me to understand the differences of what it looks like. And I think that she's been doing a really good job, especially since I got older. She's on medications, is more regulated than some of the other things. But that was like very difficult to deal with as a child because you always felt like it was you and you never knew what you could do. It never felt like you could do nothing right. My mom, on top of having bipolar disorder, she also has OCD. So she's overly clean, and it feel like, okay, I'm trying to fold up towels, and it's like, nah, don't fold up my towels. Then when I don't fold up the towels, it's, why didn't you fold up the towels? And it's like this never ending cycle
Right.
where it's like, how can I rationalize this as a child? So it was very chaotic for me. But to see her get on medications and be more regulated, I've noticed that she has not had those manic episodes where they used to be sustained, you know? So as y'all talk about the different types of bipolar disorder, what they are, what they ain't, could y'all kind of speak to what it's like for, because we might have somebody who's watching in on the show. What is it like to experience the world through a bipolar lens?
Ooh.
I think you just did a good job doing that, you know, because it's the direct and indirect effects that people experience from people that are suffering from unmanaged diagnoses, such as bipolar disorder. I think it's important for people to recognize when a person does have bipolar, their mood can change. And so they can be sitting with you and seemingly enjoying themselves and having a good time. And then at some point, their mood may change and they may become more solemn. And so the natural instinct to do, you know, is to say, what's wrong? Right? And you say, what's wrong? And the person say, nothing. Leave it. Because to them, nothing is wrong. But when you keep saying, what's wrong? What's wrong? What's wrong? Then the person becomes more heightened and more irritable and more agitated. That's hard for people because you love. That's hard for people because you care. And so how come, or saying what's wrong, you know, it's a natural thing for a person to do. You know, and to see somebody change or have a moment where they've gone from being their normal self to now this more solemn self, it's a difficult transition. And I would tell the person, get up, move around, you know, go get them a glass of water, sit there and chill, because after a while it's going to change. You know, they don't even recognize their facial expression or their demeanor has changed at that moment. It's just something that's happening. That's number one. Number two, it's recognizing sometimes when a person is manic. You know, a lot of times we don't even educate families the way that we should. I have made that part of my practice when people have been diagnosed with something and they do have a husband, or they have children, or they have people that they live with, to make sure that everybody is involved and everybody understands what's happening. Because even when they start taking medications, it's going to be a change. Maybe the person might sleep a little bit more. Maybe they'll have some different mood changes. And I know I'm all over the place with this, but I'm saying that to say it's important for them to be able to have that sense of awareness of what's happening so they can be educated on it as well. Sometimes people can have distorted perception, you know, and a distorted perception is like when we're having a conversation and I'm trying to explain something, but what I'm saying to you is not what that person is hearing. And I'm saying, hey, you know, I just want you to put up the dishes for me when you get done. That way, when the kids come in the kitchen, they don't put the dirty dishes on top of the clean dishes. But I washed the dishes. I didn't say you didn't wash the dishes. I'm just asking you to put the dishes away. So, but what they're hearing is something totally different than what's being said. So being aware that that can happen when you catch that kind of conversation, a person can be like, oh, okay, no problem, I got it. Because that's not even the time. We'll have to come back to that at a different point, right?
Yeah.
You have to come back because that's not even the time. You can go over the same conversation and end up turning into an argument because what you're saying is not what they're hearing. Did you notice that with your mom?
Yeah, definitely.
And so you learned over time to do what?
Leave it alone.
To leave it alone.
Leave it alone. And I think more so with one of my little brothers, he suffered from the same thing. But I think, if I'm not mistaken, he was clinically diagnosed with having bipolar schizophrenia. So it's a different aspect with it as well when you start talking about the warped perceptions, and when you talked about the type 2, like the short burst of anger and stuff like that. I noticed more of those type of things with him, and he could just be very much sitting still in the place, and then I see a look overcome him, and then next thing I know he's
It's almost
outburst.
like a glaze.
Yeah, a glaze come over the eyes, and it's like, okay, you in a zone right now. So I do think it's important to help educate family members so that they could
Absolutely.
be a part of the healing process, so that they can help understand, and then not ultimately end up triggering people into having an episode inadvertently. So
I was just gonna say support is key.
100%. I think on the flip side of that, though, I do think it's on us as individuals. If we do notice ourselves having these symptoms, and we have people around us telling us that we're experiencing this, it's on us as individuals to go seek out that help. Bipolar disorder is one of those disorders that is going to be very hard to treat without medication.
Right.
Unless you literally completely change your lifestyle, like you change what you eat, you change what you consume, you change how you walk, you change how you breathe, you change how you do all, because bipolar disorder is a constant chemical imbalance. Constant. The reason that you are experiencing these low periods in time is because your neurotransmitters are completely off. They're completely off. And the only way that you can regulate that is through something that is specifically designed to bring those up and consistently bring them up. Right. So like when I have individuals who come into my office and they are struggling with some type of bipolar disorder, if they're not medicated, I can't, it's hard to work with them, because we will be readdressing the same thing just in different situations over and over and over and over and over and over and over again. There will always be an acute situation that's at hand. There will never be a place where the individual is at a baseline, right? Mania will seem like they're at a baseline where they got this increased energy. It's like, all right, yeah, I'm gonna go do this. I'm gonna go do this. And that'll be the one week they come in, and then the next week they come in, they like, man, F all this. F all, I don't even care. I don't even. And it's like, if you are not regulating your chemical levels, it'll be hard to do anything if you're struggling with bipolar disorder. So when I hear you say, like, fortunately my mom is now taking her medication, like, you probably see the night and day difference between mom on medication, mom not on medication. And it's being able to come to a place and the understanding of, like, if I'm not in a place to truly remap my life, like not like learn a couple coping skills here. No. Like, I can't be eating all these processed foods. I might need to start looking at like holistic medicines, right? Like I need to look at the supplements that I'm taking. I might need to go get me some ashwagandha and some daisy root and all, like. And me saying this, again, do not take this as a recommendation, because I'm not out here saying that these are the things that are going to help to curb your symptoms of bipolar disorder. But what I'm saying is like, you are going to have to start to adopt a whole new lifestyle. And if you're not ready for that,
Right.
please go see you a psychiatrist. Go get you some medication and go regulate that. Go regulate that, because if you're not, like, one of the things that I do not think is fair as people who are loving and supporting individuals who are struggling with bipolar disorder is when they put their disorder on other people to manage and to regulate and to accept. Right. I think there's one aspect where people as individuals who love an individual who is struggling with that, you need to become educated on it, and you need to learn not to intentionally do things that are triggering. But there's just as much energy that needs to be put in from the individual who is struggling to make sure that they are managing and make sure they are regulating themselves. I believe that's super important. And I think that with majority, not all, because there's some mental health conditions that it's like you're powerless over this. I think schizophrenia being one of them, right? Like, you can't, like, a person who is in psychosis cannot do anything about their psychosis, right? Like, it's hard to ignore the voices and ignore the delusions that are right there in front of their face. Like, they can't. But when you know that you are struggling with this thing, like, it is just as much a responsibility for you to go ahead and do something about that. Go talk to somebody. Go get that medication.
Absolutely.
And stop letting that be the crutch for your life.
I think sometimes with people, it's difficult for them to take the medicine. And taking that medication becomes a chore. It becomes something that they tussle with. I don't like the way it makes me feel. I'm not my normal self. I sleep longer than what I should. You know, I'm already struggling getting the kids to school, but when I take the medicine, Monica, I sleep till 9 o'clock and they late anyway. So I might as
Correct me
well.
if I'm wrong too. I believe also another one of those symptoms is weight gain.
Increasing in weight. Yep. Tend to overeat or undereat. And that was something that goes along with depression. The eating, overeating or not eating at all, right? But you see that with people with bipolar disorder too. I just think that it's important, like Peyton was saying, to be able to be responsible for what it is that's happening to you. But we also have to recognize that some people don't even know that that's what's happening to them. So it's hard for them to take responsibility of something that they don't even understand themselves.
100%.
Once they have gathered the understanding and they have had someone, whether it's a community health worker to point them in the right direction, or someone like yourself, Johnny, who's working in the community and providing resources and guidance and social supports, or someone like us, Peyton, who provide mental health services that come into contact with them and identify those symptoms for them as what they are. It's important at that point to be able to educate them on what it is that they can do to alleviate the discomfort of those symptoms, and prepare them for some of the things that could occur when taking medications and side effects. Right now, there is some genome testing that can be done that can offer some kind of assistance with people that don't like taking medications, that are scared to be guinea pigs. And I don't want to be put on different medications till they find one. And I get that.
Which is valid.
But that one kind of helps to reduce the chance of them not having to try so many meds, because it's, for them specifically that'll work with their body. I think that's important because by doing so allows them the ability to get their life back. But in the meantime, I tell people and the patients that I serve that have bipolar disorder, there's nothing to be ashamed of. That's your superpower. You get up and you have a boost of energy. You know how many people that would desire to have that boost of energy to be able to clean up their whole house in a day after it had sat for 2 weeks? They would want to bottle that up. Don't feel bad about that. You know how many people that would love that creative mind that you got? Tap into those things instead of running away from them. And by taking the medication, it helps to kind of manage some of those symptoms. It don't completely take them away, but it definitely helps to manage them. And so that person can think and respond and handle things in a more calming way, in a more way that's suitable for their lifestyle, and it doesn't impede on their daily activities. And that's what we're looking at, is how do we manage symptoms to the point where they can do what they need to do and maintain employment and maintain relationships without them being destroyed. And so I think those are the key aspects that I look at in terms of being a clinician when working with the person and when wanting them to take medication, or knowing that, I shouldn't say wanting them to take medication, when knowing that they could probably have a better lifestyle if they could take medication to help them manage the symptoms. It's always a personal choice. And it's not my job as a clinician to force, push, propose. I don't get any kickback from any medication usage. We just don't.
Right.
But we do understand how effective it can be for a person when they are struggling with symptoms.
Right.
And the life-changing effect that it can have from a person. You can go from not being able to maintain employment and being homeless to being able to maintain employment and maintaining your own sense of stability and having your own sense of shelter, And when we look at wanting to be able to maintain yourself, that's the key, right? We want you to be healthy. We want you to live well. We want you to enjoy your day to day, And so if that can help you do that, why not? Why not?
That part. That part. So I know we're coming down to our last few minutes. Brother Peyton, is there anything else that you want to expound on when it comes to bipolar disorders or any type of symptoms or anything to do along the line of the topic?
Yeah, I believe bipolar disorder is one of those disorders that's going to be hard to identify unless you're very self-aware for yourself, or you're somebody who listens to other people around you, and you have people who are giving you like sound, and sometimes it might not even be sound, like they're telling you about yourself, and you're able to take that and hear it and dissect it for yourself. So I truly believe that it is important for each one of us as individuals to like practice good overall health. That means go to your doctors like at least once a year.
Right.
Go to your dentist every 6 months.
Right.
Go see a therapist every 3 to 4 months just to check in and make sure things are going good, and be open to talking about the things that you're experiencing and the things that are happening. Because if you practice good health, you'll be able to start to identify the things that are wrong. Like if you go into the therapist at least every 3 to 4 months and checking in and making sure like everything is good, you're probably somebody who's going to notice like, man, I was in this situation and X, Y, and Z happened. And it might prompt your therapist. It might prompt your therapist to be like, let's try a couple of assessments to see like if there's something deeper going on here. And you might be able to identify like, okay, maybe I need to go talk to this psych to see if I'm struggling with bipolar disorder. So just practice overall like good hygiene, for a lack of better terms, to keep your mental health in check.
Absolutely. 100% agree.
Yeah.
Any final thoughts from you, Monica?
I stamp that. Stamp of approval of what he said.
Yeah. So this is definitely one of the topics that I don't feel like I had too much to contribute to it, so I could just learn. So I appreciate y'all for walking us through this. There's a lot of people out there who's struggling with these complex diseases and disorders, and then to know that they can still have a sense of normalcy and not be identified with what they are experiencing, that it could be helpful. I think it's super dope. So I thank y'all for the work that y'all doing, everything that y'all been doing, the work that y'all putting in the community, the care that y'all have, the due diligence that y'all have. I think it's very much important in highlighting some of these disorders and then helping people seek treatment if that is within what they need. You know, so everything don't need treatment, but some of these things are only manageable with treatment, with medications and stuff like that. So I think of as somebody who, listen, they was trying to put me on medications when I was younger, bruh. What? Because I had anger problems. What? So when I heard you talking about everybody who has outbursts, it might not be bipolar disorder. It could be some type of other what did you call it?
Intermittent explosive disorder.
So it could be something like that. I'm like, bro, I used to flush the pills down the toilet in 7th grade and then redirect my behavior. You know what I'm saying? Like, bro, yeah, I'm not. And I think that it's important to have these conversations, one, for people who have the fear of medication, like you mentioned, Monica, people who might fear being a guinea pig, and then also knowing, too, that as therapists, y'all not getting a kickback from, telling people to go and seek a psychiatrist who might be able to prescribe them certain medications. There's no kickback coming, so there's no bias in trying to get people help. So I think it's important, one, right, to talk about the stigmas of the disorder itself, but the stigma around the practices around diagnosing these disorders too, because that's a major barrier to people seeking help and getting treatment. So thank y'all again. It's been another super dope episode, man. So I'm Johnny No Good.
I'm Monica Lewis.
I'm Peyton Hogan.
And we out.